Welcome to another episode of Plastic Surgery Uncensored. As always, I'm your host, Dr. Rady Rahban, and this week's episode is yet another one of my usual rants. This time, it's about the distinction between cosmetic surgeons and plastic surgeons. Now, for those of you who've been listening to my podcast now for 5 years, know that we record this several times in the past because it's such a big topic. And instead of just re-recording it, I like to instead of just reposting the old recordings, we re-record it because, well, I feel like it's fresh and it's got new energy. At any rate, it pisses me off so much that I want to re-record it myself every once in a while. So hope you enjoy the show and pay close attention because we're going to go through a lot of very sticky information. So in the past, if someone wanted to do their breast, their nose, any type of aesthetic, I'm going to use the word aesthetic right now so you understand. Any type of aesthetic surgery, you would go and find yourself a plastic surgeon. The end, that was the end of it. At that point, if you really wanted to do your homework, you'd say, is this plastic surgeon board certified or not? And what that would mean is that that plastic surgeon, after they finished their plastic surgery training, they sat in front of the American Board of Plastic Surgery, they got tested, and that board deemed them, according to their standards, to be certified. And they would certify you as like super top-notch excellent. In my humble opinion, there is a zero, and I mean zero reason for you to ever be operated on anyone that is not a board-certified plastic surgeon. There just isn't. There's so many of them, and there's so many great ones all over the country. So that's that. The confusion started years and years ago when other surgeons who were doing other specialties, let's just take, for example, I was a general surgeon removing gallbladders. I removed gallbladders. I did hernias. I did intestinal surgery. Many years ago, those surgeons, and this is my opinion, their reimbursement, the money they were getting for their surgeries, was getting diminished. And that's the fault of the American public. And what happened is that their insurance payments for a gallbladder removal went from $10 to $8 to $7 to $5 to $3. And so it became less desirable for them to do your surgery, take on the risks, etc. And while they were doing your gallbladder for $3, in the operating room next to them was their friend, who was a plastic surgeon, doing a breast aug for $10. And they were thinking to themselves, hey, what the hell? This is bullshit. Why am I getting $3 for your gallbladder and that guy's getting $10 for your breast aug? I can do a breast aug. And enough of them decided that this is bullshit and they can do it, that they literally decided, let's make our own specialty. Did you hear what I just said? They all decided, let's make our own specialty. What are we going to call it? Cosmetic surgery. Oh, wait, that's tricky. They didn't call it plastic surgery. They call it cosmetic surgery. And they call themselves cosmetic surgeons. So who are these people? None of them are plastic surgeons. None of them went to plastic surgery school. These are all people who went to OBGYN, general surgery, orthopedic surgery, urology, whatever, and then decided, F this crap, I want to do boob jobs and facelifts and rhinoplasty and tummy tucks. So then over time, this group created their own alternative universe called the Cosmetic Surgery Board. They actually made their own board. In other words, they all got together and said, let's make our own board. And they made up their own training and they made up their own parallel universe. It's literally the equivalent of the regular web and the dark web. And then they started giving themselves certificates. So they're like, okay, so you're a general surgeon. You went to general surgery school. You graduated. You got pissed off. You went to the cosmetic surgery group, got some, in my opinion, hokey pokey training. You now call yourself a cosmetic surgeon, and that board, which is not the accrediting board of America that everyone respects, their own self-board gives them board certification in cosmetic surgery. Now you can begin to understand how goddamn confusing this is and why so many patients get screwed. So you're online and you're doing homework, and you're coming across surgeons that are so-called cosmetic surgeons board certified. If you don't know any better, 99.9% of people, sounds great. They go so far as saying that they're specialists in cosmetic surgery, and me as a plastic surgeon, I'm general. I was trained in burn surgery and hand surgery and whatnot. That's how crazy they double down. And then if you dig and dig and dig, none of them went to plastic surgery school. And if you dig, they're board certified usually in OBGYN. They're board certified in general surgery. They're board certified in orthopedics. And so this is really problematic. Once more, patients are in disbelief. There is just no way this is true, Dr. Rahban. How is it possible that in America, you have this group of doctors doing things they weren't really well trained to do? Isn't the government involved? No. Isn't the board involved? No. You think that there's some overriding, arching governmental agency, something watching out for you, making sure that people are doing what they're trained to do. And the answer is no. In America, if you get your medical degree and you do 2 years of any basic residency, you can go and practice any damn medicine you want. So if I, Dr. Rady Rahban, tomorrow wanted to do a nephrectomy or remove your kidney or gallbladder or whatever, I could. Now, how is that possible? Here's the cornerstone. This is how they get around it. If I go tomorrow to Cedars-Sinai Medical Center, one of the top hospitals in the country, and I told them that I, Dr. Rady Rahban, wanted to do brain surgery, they would not allow me to do it. Why? Because I, Dr. Rady Rahban, have no privileges, no right to do that at Cedars. Cedars would then check my training, how many of them I've done, get peer reviews, and Cedars would decide if I'm allowed to or not, and clearly they won't let me do it because I have no right doing that. If, however, I go to a private surgery center, one that has nothing to do with a hospital, let's say even better, my own surgery center. Who is the medical director of my surgery center? Me. And I, Dr. Rady Rahban, decide who gets to do what in my surgery center. I am the one that is giving accreditation to people. So the reason this is happening and the reason this is possible is because 99% of aesthetic surgery, notice I didn't say cosmetic surgery, is being done in private offices, in private surgery centers. So Dr. Joe Smo, who's an OBGYN, can do your tummy tuck, advertise as a cosmetic surgeon, confuse the shit at you, call himself board certified, and pow, you have a complication. And you are scratching your head going, what the fuck, how did this happen to me? Who is the one that has to carry this burden? You are the one. You need to do the homework, you. And I'm telling you, it's super confusing. So much so that I have had other doctors come to me for surgery, and when I ask them who all they've seen, they give me the name of 1 or 2 people. I'm like, wait, I've never heard that person, because I obviously know everyone in the community. We Google them and we dig and dig and dig and dig and dig into their website, only to find out this mother effer is not even a plastic surgeon. And this is a doctor who got confused, let alone a regular patient. Now, between plastic surgeon and cosmetic surgeon, there is 2 other specialties that fall in between. ENT, ear, nose, and throat. I went to school, I trained, and I do, ears and sinuses and throat surgery and things like tonsils. They go on to additional training, and then they come out and they do facial plastics. So I want you to listen very carefully. They go on to do facial plastics, means they come out and they start doing aesthetic surgery of the face. They do nose jobs, facelifts, eyelids, etc. Is that okay? Yes, that's okay, because they're well trained and they got additional training and they're staying within their lane. They and plastic surgeons are allowed to do nose jobs and facelifts and eyelids. But what they shouldn't do, and what they do all the time, is drop the word facial, call themselves plastic surgeons, which is misleading. And then in addition, many of them go on to do things that they shouldn't be doing, like breast augs and tummy tucks, which they have no training to do. In addition to this group, you have ophthalmologists, guys that went and trained about the eye. And they go on to do extra training. And then they go on to do cosmetic surgery of the eye, eyebrow, eyelids, blepharoplastics, etc. Is that okay? Yes, because they're well trained to do eyelid surgery. So that means that if you decide to do your eyelids, you can go to an oculoplastics, facial plastics, or plastic surgeon. All fine. But when you go see an oculoplastic surgeon doing a facelift, we got a problem. They're outside their lane. And for all of you who feel overwhelmed and wow, this is so goddamn confusing, you have every right. This is a very confusing subject matter. And as a result, patients every day in this country, and frankly, this is happening globally, are going to wrong people with shitty training, assuming that someone else is going to help them. You need to understand the alphabet soup I just said to you, and you need to do your homework. So I'm going to review it for you one more time. Plastic surgeons go to plastic surgery residency. Plastic surgeons can then be board certified in plastic surgery. They are, in my opinion, the grand poobah of aesthetic surgeons, head to toe. Then you have ENTs who go on to do aesthetic training in face and neck. And if they decide to do facelifts and noses and things, no problem, well trained. What they ought not to do is advertise themselves as plastic surgeons, that's misleading, nor should they do anything, as we say, south of the clavicle. Then you have ophthalmologists who go on to do aesthetic training, and they should and can 100% do cosmetic surgery of the eye, but should not eliminate the word oculo and call themselves plastic surgeons that specialize in eyes, and absolutely should do nothing other than eyelids. And the last, and by far the most misleading, in my opinion, inaccurate group of people are cosmetic surgeons who are OBGYNs and general surgeons and everyone that has no right doing this, who created the alternative universe, give themselves their own boards, and frankly, in my opinion, are really confusing patients and, in my opinion, misleading them. Now, as long as you know everything I just said to you, and you decide that, hey, I found a cosmetic surgeon, this person was an OBGYN by training, went on and did whatever additional training they like, and I like their work, and I know that that's who they are, all the power to you. That's called an informed decision. That's called informed consent. You know who you're dealing with, and in that respect, no problem. I'm all for it. If you go to an ophthalmologist and do a facelift and they told you their training was in ophthalmology, all the power to you. Why I am pissed is this is done to mislead people. And I have pushed and pushed and pushed and pushed for academic transparency forever and ever. That means every single website should have your training as clear as English so that patients can decide for themselves rather than all this misleading information. And, well, frankly, no legislation like that even comes close to existing. So I leave this with you. You're on your own. So my recommendation to you, as it has always been, is do your homework, do your homework, do your homework. And I hope this episode helps clarify a little bit for you the alphabet soup of aesthetic surgery. And yeah, just be careful. All right, that's it. That's a wrap. That is this week's episode of Plastic Surgery Uncensored. As always, 2 requests. 1, go and write us a happy review. Go write us something nice. If you have nothing nice to say, don't write anything. And secondly, if you know anyone that you think might sort of be considering plastic surgery, send them our podcast. The last thing you want to hear is that they do surgery, they got botched, and you're like, God, I wish you had listened to this episode. Well, how do they know that this existed? So those are our 2 requests. At any rate, signing off as always, Dr. Rady Rahban on this week's episode of Plastic Surgery. See you next week.